Hi everyone, hope you're doing well coming to the festive season. Today I wanted to visit a topic that gets brought up quite frequently, and that is on the subject of caffeine and hair loss. Now, I just want to excuse myself for this white spot on my face. Please don't be distracted by it too much. It's just a bit of Benzac for my zit that has broken out on my face. How fun is that? Now, caffeine utilization, as a hair loss treatment is not obscure. Now, there are many commercially available products, specifically being shampoos and other topical items that have caffeine and are specifically marketed towards hair loss. Now, one of the most famous products is Alpecin, and there are other brands that have, caffeine shampoo variants such as Head and Shoulders. Now, for the avoidance of doubt, we are talking about topical application of caffeine and not oral administration. Caffeine, at least orally, consumed orally, is one of, if not the most used drug in the world, and is contained in coffee. Even decaf coffee has, 4% of a standard shot. Soft drinks, teas, energy drinks, you name it, even, foods like chocolate. Now, obviously, oral consumption of caffeine does not have any hair loss prevention properties, else you wouldn't see caffeine smashing office workers or investment bankers on their balding journey, or, arrived at their balding destination. Now, caffeine as a drug obviously has a lot of health benefits, specifically, cognitive function, use in an athletic context, it can help with focus, concentration, weight loss via hunger inhibition. It's really an amazing drug when it's not abused or used in excess. And I think it warrants another video down the line on, the specific properties of caffeine and, benefits of coffee as well. Now, back on the topic at hand, we're here for the topical application of caffeine and how and if it can even help with hair loss prevention at all. Now, we do know through studies that caffeine penetrates the skin barrier, so it's been examined pretty extensively as a potential treatment for androgenetic alopecia. Now, everyone knows, or if you're on my channel, you will know that it's well established that androgens, and most notably DHT, dihydrotestosterone, is the main factor in hair loss in individuals who have androgenetic alopecia, which is when hair follicles are genetically sensitive to androgens such as DHT. The way DHT destroys the hair follicle, just for all your benefit, is by disrupting the growth cycle of the hair follicle through the inhibition of IGF-1, which works as a regulator of the hair growth cycle. As IGF-1 is inhibited by DHT, this will cause the growth phase of the hair follicle, known as the anagen phase, to shorten, whereas the resting phase, known as the telogen phase, will be prolonged. This in turn results in the subsequent miniaturization of the hair follicle and progression of balding. So if you have seen hairs falling out, or if you've been concerned about it, you will notice that they'll actually get thinner and thinner and thinner. Like you'll have, certain hairs will be a bit thicker, and then the ones that are wispier and, very, very thin, you can sort of see that progression in real time if you're, obviously, undergoing balding. Now, caffeine is not hormonal in any way, and it's not going to inhibit DHT or any other androgens on the scalp. But as we know with other non-hormonal treatments such as minoxidil, the inhibition of DHT is not necessarily a prerequisite for the efficacy of a hair loss treatment. Some compounds, like minoxidil for example, work as hair growth stimulants, and what they manage to do is promote the growth of the dermal papilla cells, even as DHT tries to destroy them. This is why dermatologists will often recommend, use both the growth stimulant like minoxidil in combination with an anti-androgen or call it a 5-AR inhibitor like finasteride or dutasteride, as combine the two drugs, often has a very synergistic effect for individuals and can be much more effective in, slowing the progression of hair loss or regrowing hair for, a good chunk of individuals. Now, caffeine specifically works by inhibiting the enzyme phosphodiesterase, which I hope I said that right, which is part of the system that regulates the level of cyclic adenosine monophosphate, being cyclic AMP, in the cells. Cyclic AMP is a growth stimulant and, among other factors, is created by the conversion of ATP, adenosine triphosphate, to cyclic AMP by substances that stimulate the beta receptors on cells like adrenaline. So the enzyme phosphodiesterase breaks down cyclic AMP, so as a phosphodiesterase inhibitor like caffeine prevents cyclic AMP from breaking down. Sorry, I know that's a big mouthful and a bit of jargon there, but effectively where we get to is that both adrenaline and caffeine end up increasing cyclic AMP levels, though through different mechanisms. So this is why when you get an adrenaline surge, you get all jittery, and when you drink too much coffee, you feel the same way. It's all due to this increase in cyclic AMP in your cells. Now, coffee and specifically caffeine, has a lot of different properties, and that warrants, as I said, another video down the line. So like I said, cyclic AMP is a cell growth stimulant, and thus the hairs, causes the hairs to spend more time in the anagen phase and less time in the telogen phase, at least theoretically. Thus, will stimulate hair growth or delay this process by which hair follicles miniaturize. Now, in terms of the in vitro studies, which effectively examines hair follicles outside the body or in a test tube or petri dish, these studies suggest caffeine can indeed prolong the anagen phase, boost IGF-1 production, and prevent follicular apoptosis, being the death of the hair cell. Now, in vivo studies, which are obviously a bit more relevant because they actually involve human participants, are obviously a bit more relevant. Now, a 2020 study compared 0.2% caffeine solution to 5% minoxidil. It found treatments similarly increased the number of anagen phase hairs. However, the study had a few limitations in that it, one, was not double-blinded, meaning participants and researchers knew which treatment was being used. There was also no placebo group, and it was funded by a guy called Dr. Kurt Wolf, a manufacturer of caffeine-based hair products. These factors, goes without saying, can introduce a bit of bias there. If you're selling a product and it makes a big, your product SKU range, if it's a big, component of, what drives your company and your revenue and your overall profit, you're obviously going to be a bit biased if you're doing a self-funded study on the efficacy of what you're saying the product or purport the product to actually do. There is some inherent bias there. Now, their main endpoint in terms of the study was actually looking at a change in the proportion of anagen hairs from baseline up until about 6 months versus hairs not in the anagen phase. So it's a bit of a weird approach they took. Now, they basically wanted to see how many hairs were in the growth phase on treatment versus how many hairs were in the growth phase before treatment. So they assessed this by plucking a set number of hairs from the scalp and then examined them under a microscope to examine what growth phase each of the hair follicles was in. Now, a big problem with this approach is where the hairs are coming from. Now, not all hair follicles are equally androgen sensitive. Although they say that the hairs came from the frontal and occipital regions, even just minor changes in the location of hair harvesting can have a pretty big effect on the results, right? Now, this is again a problem since the study is open label. Investigators might be biased in the selection of hairs, right? Now, a much better way to measure this would be use something like a phototrichogram and measure things like hair density and hair count per square centimeter. And this is effectively what was the approach that was taken with finasteride and minoxidil when they went through clinical trials to get FDA approval in the first place. Now, let's be clear, the evidence for caffeine's effectiveness isn't as robust as that for FDA-approved treatments, but that doesn't mean it's useless. And I'm not here, going to just bash on it or say anything definitive, just given obviously it just hasn't been proven yet that it's efficacious by itself. It could be quite useful as a supplementary option, as effectively for those looking to diversify their approach to hair care. Now, Dr. Wolf Group, which conducted the studies, owns the Alpecin and Planter brands, and they I think in 2023 they had total sales of around sort of 400 million euros, which was predominantly driven by their hair care products being caffeine-based shampoos under the Alpecin and Planter lines. Now, this is, if you can imagine if, half of that turnover is accounted for by those products, you're going to be very well incentivized to be pushing forward research or analysis that, supports the efficacy of those products. Now, there may or may not be a conflict of interest there. So, obviously more robust research, will be required going forward to sort of see if there is any real benefit there. But for the moment, I think, as is sort of tried and tested and still very relevant nowadays, it's probably best to stick to the FDA-approved treatments insofar as the first-line defense for hair loss. Things like caffeine, even things like Nizoral or ketoconazole shampoo, they're much more ancillary treatments and, they're definitely not the needle mover in terms of, treating hair loss or dealing with that. So just a quick video just on caffeine. So I know I don't post very regularly, but we will slowly get there, very slowly. But have a great holiday break, and I'll see you soon in the new year. Thanks, guys and girls. Bye.